Hi, welcome. I hope you recognize me. I'm Dr. LeSage, Brian LeSage, and we're here in front of my office. And what I wanted to do is show you the changes we've made, all in the interest of your safety, the team, the staff's safety, and really our community safety. So if you look at our front door, obviously we're all wearing masks. Everyone knows to do that. You see I've got my mask on. And now one of the key things is we're having all the deliveries brought to the back door. And so nothing is coming through the main office, just like you're probably doing at your home, where packages come in, you clean them, you disinfect them. So this is all getting done through our kitchen, if you will, our staff lounge in the back. And then you'll also notice that now we're asking for flow of patients. The entrance now is going to be through the Beverly Hills Institute, my teaching center. All of these precautions and protocols are for the safety of our patients, for the team members, and for our community. And so now our new entrance to the office, to the Beverly Hills Institute of Dental Aesthetics, is right here. And so I've converted my teaching institute into a reception room here for the patients. Again, so it's one-way flow of traffic, and that we respect social distancing. As we look into the office, into the old reception room, you can see Sal. It'll be either Sal or Maria greeting you. They'll greet you with gloves on and a clipboard and the touchless thermometer. And so he will welcome you into the institute. And now he'll ask you to come over to our little station here, and he's got a clipboard, and he will take your temperature, all touchless, painless, doesn't hurt. So we have clean pens that have been disinfected and put in a protective barrier. So you can pick up one of these, all right? And then he'll have you, from a distance, he'll write down your temperature, and then you'll check. Do you have a fever? No. Do you have cough? No. Do I have shortness of breath? No. Have you been in contact with someone with COVID-19? No. And then you'll sign that, right? Just so you know, all the team members, myself included, fill this out every morning. So all the team members have to fill the same form out. We take our temperature, and we're going to do what we do next, which is really a pulse oximeter. So then he'll offer you a glove, and you place the glove on your hand. And then we'll measure your saturation, your O2 saturation, just with this little small device again. Sal tries to stay a little bit away from you, maybe Sal and Maria, and doesn't hurt, just like you would have in an operating room or so. So it's saying my saturation of oxygen, my O2 saturation is 98. Anything over 90 is very acceptable, and so we're very good there. And then, of course, we dispose of the glove. Once we've completed this station, then Sal will take you back into the treatment room, the operatory. And as we scan what was our older reception room here, you'll see we got a barrier here at the front desk here. So again, just trying to keep social distancing. So we have a barrier here, just like you see at the bank or the grocery store. And then Sal will take you into the operatory. So now you can see we're in the operatory, and you can see really how clean, how barren it is. And so really, again, for everybody's safety, we've really removed everything from the counter. We just have our gloves, but the glove boxes are covered. All right. You can see on the floor here actually is where we'll ask you to put your purses, your backpacks, these types of things. Again, everything, all these covers get changed between every patient. There's a cover on our light. We now have covers for the chairs. All right. Obviously the headrest cover, which we've always had. And then we've also added a nice HEPA air filter and a UV filter on that. So all the treatment rooms have this to really just try to recycle and keep the air as clean and as sterile, disinfected as possible. So additionally, the way we're protecting really the team members, if you can see here, now I hope you recognize Sheila, right? So Sheila, she's been with me for 13 years. And so you can see, she's got a head cover on, a head cap, really. And then she's got the face shield. She's got a KN95 mask with her goggles, all right, and her loops. She uses loops obviously when she's cleaning your teeth, all right. And then she's got the typical gown that we wear, and so certainly she's got gloves on And additionally, we actually, we have her wearing booties. So this would be what you would see all the team members wearing when treatment. I will say this about the hygiene program. We will not be using the Cavitron, we will not be using the ProfiJet unit. Those are in lockdown, very, very strictly so, by the CDC and the ADA. So the hygienists actually have to work a little harder now. They actually have to do everything by hand scale, but that's what we're required to do. So just to give you a little heads up there as far as what you'll experience in hygiene, and classically in the short term also, generally the doctors won't be coming in to do an exam. The exams will all be done by the hygienist. If they see something questionable, they'll take a picture, and many times then I'll have to call you, or Dr. Malakay will call you afterwards and share our thoughts on what was seen. Okay, so again, all part of the PPE protocol and the limited amounts of PPE that we all have. So sorry to inform you of that, but certainly the care is not compromised. You know, Sheila's taken excellent care of you through the years, so, and the hygiene program, it does very, very well for us all. Here you can see a patient checking out, very nice young man, okay? And so he's standing behind the clear barrier again, so social distancing, and we have a pen here that's clean, and we'll allow them to use that to sign any of the documents that they need to sign. You can see Sal is also staying behind the barrier, so again, we're trying to respect the 6-foot distancing and really limiting the number of patients that we see in the practice at one time. So these are all the changes that we've really tried to make so that you know really that it is safe, and that you're going to be taken care of incredibly well. The team is really well prepared. We've trained, we've practiced drills to make sure really that everyone knows all the protocols we need to follow to really get back to having fun. Really get back to having fun doing dentistry and really doing some nice high-end aesthetic dentistry, some really comprehensive long-term dental care in a very, very, very safe environment. Really look forward to seeing you very soon here at Beehive, the Beverly Hills Institute of Dental Aesthetics. As you know, my office, the office of Dr. Brian LeSage and Dr. Malakay. Thank you. Stay safe. Be well.